Hi everyone. We are going to discuss about the dissociation curve and the Bohr effect in this video. Oxygen dissociation curve is a graph that shows the relationship between the partial pressure of the oxygen and the saturation of the hemoglobin with the oxygen. In other words, this graph is going to show how the oxygen concentration can affect the hemoglobin in taking up or release the oxygen. Based on the graph, we can see that at high partial pressure of the oxygen, the saturation of the hemoglobin with the oxygen is also very high. Well, on the other hand, when the partial pressure of the oxygen is low, then the saturation of the hemoglobin with the oxygen is also low. So for example, when the blood passing through the lung is an organ where it has high oxygen. So that's why the partial pressure of the oxygen is quite high as well, which is 12 kPa. So at 12 kPa, we can see that the saturation percentage is around 98%. So this means that when the red blood cell passing through the lungs, which has 12 kPa high PO2, the red blood cell will take up a lot of the oxygen and reaching 98% saturation. But this happens because under the condition with the high partial pressure of the oxygen, it will cause the hemoglobin to have higher affinity to the oxygen gas. So that's why more hemoglobin will be binding to the oxygen to form the oxyhemoglobin. And that is also why it is achieving 98% of the hemoglobin will bind to the oxygen. On the other hand, we look at the respiratory cell or the muscle, which is having low partial pressure for the oxygen, around 2 kPa. When the blood passes through the muscle is having around 2 kPa, which is very low partial pressure for the oxygen. So at this time, you can see that the saturation of the hemoglobin is around 20%. So this means that 80% of the hemoglobin has released the oxygen to supply to the cell. So why this happened? This is because at the low partial pressure of the oxygen, it is going to cause the hemoglobin to have lower affinity to the oxygen gas. And this lower affinity will cause most of the oxyhemoglobin to dissociate. So once the oxyhemoglobin dissociate, they will release the oxygen and thus causing the saturation to be low. So in summary, what we can conclude here is that the higher the partial pressure of the oxygen, it is going to increase the affinity of the hemoglobin towards the oxygen and thus allow more oxygen to bind with the hemoglobin and form oxyhemoglobin. Well, on the other hand, if let's say the partial pressure of the oxygen is low, then it will cause the affinity of the hemoglobin to the oxygen to be lower, and thus causing the hemoglobin causing the oxyhemoglobin to dissociate and release the oxygen. So we have done with the dissociation curve. That is the basic concept. Now we will look at the Bohr effect. Bohr effect describes how the partial pressure of the carbon dioxide affect the affinity of the hemoglobin for the oxygen. When the partial pressure of the carbon dioxide is increasing, it is going to lower the pH. And this normally occurs in the all those peripheral tissue, like the muscle. So this decrease in the pH is going to lower the affinity of the hemoglobin for the oxygen, and thus causing more oxygen to be released. And as a result, it is going to shift the graph to the right side. Well, on the other hand, when the partial pressure of the carbon dioxide is decreasing, then it is going to increase the pH, and this is normally seen in the lung. So this increase in the pH is going to cause higher affinity of the hemoglobin towards the oxygen. And thus, more oxygen will bind to the hemoglobin and form the oxyhemoglobin. And because of this, it is going to shift the graph to the left side. So please take note that the Bohr effect is not going to change the factor in the x-axis. The factor in the x-axis will remain as the partial pressure of the oxygen. What the Bohr effect did is just shifting the graph to the right side or to the left side. So this is important because this will allow us to identify or to determine the effect of this partial pressure of the carbon dioxide and the pH on the saturation of the hemoglobin by comparing the curve. So we can compare the two curves, the dissociation curve before being shifted and also the dissociation curve after being shifted. So you can compare two of this curve at the same partial pressure of the oxygen. So with that, we can know that what is the effect of this partial pressure of the carbon dioxide on the saturation of the hemoglobin. As mentioned previously, the Bohr effect will shift the dissociation curve towards the left or right. So how can we analyze this? When the partial pressure of the carbon dioxide is high and pH is lower, the graph will be shifted to the right. So this means that at the same partial pressure of the oxygen saturation percentage of the hemoglobin will be lower. This actually indicates that more oxygen are released from the blood and supplied to the body cell. Next, how can we explain this? When the partial pressure of the carbon dioxide is higher, this means that there are more carbon dioxide. And this carbon dioxide will dissociate to form the bicarbonate ion and the hydrogen ion. The increase of the hydrogen ion concentration in the red blood cell will cause the pH to decrease or become more acidic. So the high partial pressure of carbon dioxide and low pH will decrease the affinity of the hemoglobin towards the oxygen and causing more oxyhemoglobin to dissociate. So the oxyhemoglobin will dissociate to release the oxygen and thus leading to the lower saturation percentage of the hemoglobin. On the other hand, when the partial pressure of the carbon dioxide is lower and the pH is higher, the graph will be shifted to the left. So this means that at the same partial pressure of the oxygen saturation percentage of the hemoglobin will be higher. This indicates that less oxygen are released from the blood and more oxygen remain as the oxyhemoglobin. How can we explain this? When the partial pressure of the carbon dioxide is lower, this means that the hydrogen concentration in the red blood cell is lower. And this will cause the pH to increase or become more alkaline. Lower partial pressure of the carbon dioxide and higher pH will increase the affinity of the hemoglobin to the oxygen, causing more oxyhemoglobin to remain. So lesser oxyhemoglobin will dissociate to release the oxygen to the body cell, and thus leading to the higher saturation percentage of the hemoglobin.